Hello everyone. So this is Dr. Ruchika Roy, and in this series, I'm going to start AIAPGT 2025 multiple choice questions which comes in the last year 2025 के क्वेश्चंस क्या क्या आए थे उनका आंसर नहीं उनका आंसर बल्कि उनका डिटेल वाइज एक्सप्लेनेशन सो दिस इज फॉर दो स्टूडेंट who are preparing themselves for their next AIPGT 2026 examination. Okay, so please like and subscribe my channel and just move. Okay, so this will be a small series. Okay, so let's start with the first question. Yeah. Now I'm giving you the 5 seconds to write the answer in the comment box. Write this. Policeman's heel is plantar fasciitis, Helus Welcus, Hux Rigidus, hammer's toe. So I'm giving you 5 seconds. So just write in the comment box. Though it is recorded, but I will look at the comments box about the answers. Okay. So it's about, so let's see what is the answer of this. Okay. The policeman heel, the answer is plantar fasciitis. Okay. The answer is plantar fasciitis. So what is plantar fasciitis? This is basically a fascia. This is known as your plantar fascia. If there is an inflammation of the plantar fascia, this plantar fascia is about because a thick ligament which comes from the heel and then it joins in the toes, okay, bone to that of the toes. Now if there is an inflammation of this ligament, especially the heel is affected, so there is an area, it is shown as reddish area, that is inflammation of this part is known as a plantar fasciitis, and policeman heel is also referred to, the other name is a plantar fasciitis, usually seen in the policeman and the military personnel who stood and marched for long hours. So there is a constant pressure on the heels which led to the inflammation and the pain. But nowadays you will see also the women who are cooking by standing, जो बहुत देर तक खड़े होके कुक करते हैं आप उनको भी देखोगे, और the person who are slightly obese, they are most likely to suffer from the plantar fasciitis है. So what are the symptoms है? पेशेंट अगर सपोज आप बैठे हो आपके क्लिनिक में और पेशेंट आपके पास आया तो वो क्या बोलेगा? डॉक्टर प्लीज हेल्प मी, मुझे ना वो पैरों के नीचे ना बहुत ही दर्द है. देन यू नीड टू आस्क कहाँ पर दर्द है, वेयर इज इट, देन ही विल शो यू हिज हील. Either it is right and either it is left or the both. Most of the complaint patient will come to you in a unilateral, एक ही complaint, एक ही पैर के complaint लेके आएगा और वो बोलेगा कि ये जब भी मैं सुबह को उठता हूँ तो मुझे बहुत दर्द होता है, and then if I started to walk then धीरे धीरे it reduces, but if I stand for a prolonged period of time then it's again started. So it's after long periods of standing, after long period of walking, it aggravated. Okay, and pain improves with the movement but returns after the rest. ओके, सो सुबह उठने से पहले बहुत दर्द होता है, जब वो थोड़ा चलना शुरू करता है तो उसको दर्द थोड़ा कम रहता है, एंड समटाइम्स द पेशेंट विल टेल यू द पेन इज शूटिंग पेन, स्टैबिंग पेन. So all the medicines of the heel pain, there will be graphitis, there is medorinum, there is cyclamen, there are so many medicines. Pulsatilla is also one of them. So there is an, so what is the rubric for this? Okay, if you go with the rubrics in the Kent repertory, you in the rubric you will see that extremities pain in the heels. Okay, then extremities pain in the heel, the type of the pain, stitching pain, stabbing pain. Okay, so these are the thing. Or extremities pain in the heel in the first movement. Okay, or motions, first motion. So these are the rubric you can find in the Kent repertory. So extremities pain in the heel in the morning and while walking, while standing, and the tearing and stitching pain. So what is plantar fasciitis? The plantar fasciitis, it's inflammation of the ligament. Usually the patient comes to you with the complaint of the heel pain. Okay. Now let's, what is Helus Welcus? Okay, so if you see the diagram, it shows the bending of the toe. So basically what is this? This is a deformity of the big toe. Especially it deviates laterally. That is towards the second toe. Always there is an inflammation. Okay, there is an pain. The patient will come to you with the pain and inflammation of the big toe and swelling of this area. Either the causation, what is the cause, mainly due to some rheumatoid arthritis, or tight fitting shoes is one of the cause. Tight fitting shoes, or if there is a flat feet, or if the ligament is weak. If the same thing, the ligament is weak, then this can be the reason for the Helus Welcus. So in the repertory, the symptoms, the rubric, you will see that extremities, pain in the toes, especially in the first toes. There are so many medicines, you just go and see the Kent repertory. So what are the symptoms? The patient will come to you with swelling and redness around the joint of the big toe. There is a bony protrusion on the inner side of the foot. Difficulty in wearing shoes. Obviously, if there is a swelling in that area, there will be difficulty in wearing the shoes. Restricted movement, and also there is corn and the calves in between the toes. Now come to the hallux rigidus. So what is this? Hallux rigidus is basically this part, it has become rigid. Okay, and maybe because of some formation of some calcanean spur or anything, the part has become rigid and there is an upward motion is blocked. Okay, so there is a difficulty, rigidity for the upward motions. Usually, which joint is affected? Obviously, big toe joint is affected. Basically, the first metacarpophalangeal joint. First metacarpophalangeal joint, usually seen in the person suffering from the rheumatoid arthritis or the osteoarthritis. There is a restriction in the movement in the upward direction. Okay, so this is known as a hallux rigidus. Name it shows your rigidity. Okay, now the fourth option is hammer's toe. Always there is a permanently bent of the PIP joint. Remember, this can be one of the MCQ question they can ask. Peripheral interphalangeal joint. It affects the hammer's toe. There is a bending of any toe, whether it is second, third, fourth, any toe, but there is an affection of the PIP joint. The cause due to the narrow shoes or using high heel shoes, imbalance of the toe muscles, the tendons, if the person is suffering from arthritis, if there is a flat feet or genetic predispositions. Okay, so this is an explanation of the first question which comes in the AIAPGT. So what is policeman heel, plantar fasciitis, kahan par khojna hai rubrics, I told you. Okay, so in the next video, I will do the second questions of the AIPGT. So look, this series, I have made a new playlist where I've written that AIAPGT 2025, and there I cover all the questions of this uh, in All India PGT examination. Okay, so please like and subscribe my channel to get the new update. Thank you, everyone.